Welcome back to Meds Made Easy. My name is Tarun. Today we're going to be talking about Moxifloxacin, also known as Avelox. It really just goes by Moxifloxacin. It is an antibiotic. It's a DNA gyrase inhibitor. It's bactericidal, blah, 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 blah. Let me break that down. It just kills bacteria, right? There's two types of antibiotics out there, bacteriostatic, bactericidal. This is a cidal, meaning it kills the bacteria, it doesn't stop its growth. And so that's a good thing. It hits all types of gram-positive, gram-negative bacteria, anything from bronchitis, pneumonia, abdominal infections of any kind, rhino, sinusitis, different skin infections. You can take it with or without food. It really depends on whether your stomach is able to handle it. If your stomach gets upset, then take it with food. All right, create that buffer. Let's see here. It's not affected by a high-fat meal. Sometimes that happens, so you can just pretty much eat anything with it and it's fine. It does have a black box warning for myasthenia gravis, and essentially what myasthenia gravis is it's a muscle condition that you have. It's where it's an autoimmune disorder where your muscle tone gets affected, and so this medication can make that worse. So if you have those issues, or if you have some severe sort of muscle issues, this can make things worse, so you just want to watch out for that. Lactation, I couldn't find any information on lactation, or aka breastfeeding. Pregnancy, same as well. I couldn't really find exactly if this is something you can take or not. It does cross the placenta, so maybe you do not want to take it. So talk about it with your OBGYN, and if the benefits outweigh the risks, then I guess you go ahead with it. But have that conversation with them. I'm not going to tread on anyone's feet here. With liver and renal, people who have kidney or liver issues, you can generally take this medication, not a problem, but always make sure that you're letting your doctor know about all the different medications you're on to make sure that your doctors are on the same page, right? Whenever you're in the hospital and you're on this medication, you are usually on it through an IV. If you get discharged and you go to an oral dose, you generally don't make a dosage change, which is what usually happens. So if you're on 400 milligrams IV in the hospital, when you go home and they give you a prescription to take to your local pharmacy, it should be the same dose. I've seen this taken once a day, twice a day. It just depends on what you have and what you need it for. For those people who take a drug test, this is a really weird little thing that only happens with Moxifloxacin. It can cause a false positive for an opioid on a drug test. So just keep that in mind. If you're going for a job interview and you're on this medication, and then the top screen comes back as positive for opioids and you don't take opioids, you're going to be like, what the heck? Your employers are going to go, what the heck? And go, no. You have the doctor let them know, like, hey, no, this patient's on Moxifloxacin. This can cause a false positive, right? Beyond that, here's a list of side effects here. The main thing about antibiotics is that they essentially nuke the system, right? So they go in and they kill everything. They kill bad bacteria, they kill good bacteria, which is why your doctor may tell you to take a probiotic with this medication or eat some yogurt and things like that. We want to bring some good bacteria into your body after this thing kills everything. So you want to watch out for that. So you want to watch out for pretty much anything related to a GI issue, right? Diarrhea, abdominal cramping, pain, things like that. So just listen to your body. If it ever gets too bad, call your doctor, let them know. Like, hey, I need to get switched on to something else. I'm just not able to tolerate this medication. The other big thing is with multivitamins and minerals. Everyone's a little bit different, doctors and pharmacists, on what they say. I tell my patients, take your vitamins and minerals 2 hours before your antibiotic dose, or take it 2 to 4 hours after. You just want to give your body time to digest the antibiotic and get it out before you put your vitamins and minerals in. Because what it'll do is it'll decrease the effectiveness of the antibiotics, because then they'll start binding to the minerals and the vitamins. It's just what happens, they chelate together. And so we don't want that. Alcohol, also same thing. If you take alcohol and you drink on this, it's going to reduce the effectiveness of the medication. Just try to avoid not doing that. All right? Don't do it if you don't have to. Most people still do, and it's just, you'll be sick a little bit longer. You won't get as, better as quickly. So if you have any questions, concerns, leave them down below. Let us know how we're doing. Hit subscribe, and we'll see you next time on Meds Made Easy. Bye.